Hello, my apologies. We rolling? Okay, well, good afternoon, everybody. I'm really pleased to be here today for our closing plenary. We have really exciting guest here today, Assemblymember Dr. Akilah Weber, who is new to the Assembly, not new to San Diego, former city. I'm not going to do the introduction because Brian Woods from San Ysidro Health, who's our board member, will do that. But I really want to thank you for being here. This has been an extraordinary couple of days, and our keynote guest today is really going to, I think, kick it up yet another notch. So without further ado, I'd like to introduce Brian Woods here to introduce our very special guest.
Hi, good afternoon, everybody. I'm Brian Woods, the Housing Federation board member and director of Housing Partnerships and Support Services for San Ysidro Health. The mission of San Ysidro Health is to improve the health and well-being of the communities we serve with access for all. San Ysidro Health now provides innovative services to more than 108,000 lives in our care through a vast and integrated network of 47 program sites across San Diego County, including medical and dental clinics, behavioral health centers, HIV centers, WIC nutrition centers, mobile medical units, school-based health centers, chiropractic services, pediatric developmental clinic, teen clinic, senior health center, and our San Diego PACE program of all-inclusive care for the elderly. Before we introduce our keynote, I'd like to thank our keynote sponsor, Chase Bank. Chase works with key community and government entities to help create thriving and inclusive neighborhoods. Through industry expertise, a comprehensive set of financial solutions, and a focus on bringing together Chase's business and philanthropic efforts, they support affordable housing from initial planning to property development. Thank you, Chase, for sponsorship of today's keynote. Today's keynote speaker is Assemblymember Dr. Akilah Weber. Dr. Akilah Weber was elected April 2021 to represent California's 79th Assembly District, which includes parts of Southeast San Diego, Bonita, Chula Vista, La Mesa, Lemon Grove, and National City. Dr. Akilah Weber is a medical doctor, educator, city council member, San Diego native, and mom to 2 young boys. Dr. Weber is a board certified obstetrician gynecologist, and she is the founder and past director of the Pediatric and Adolescent Gynecology Division at Rady's Children's Hospital, San Diego. Dr. Weber has served on the La Mesa City Council, where she's worked to implement the city's climate action plan and championed the creation of both a community police oversight board and the La Mesa Homelessness Task Force. Since the outbreak of COVID-19, Dr. Weber has also been on the front lines of the city's efforts to protect public health. Her long record of community activism includes serving on the boards of La Mesa Conversations and the La Mesa Foothills Democratic Club, and volunteering as the science coordinator for the Links to STEM program for children who are underrepresented in STEM fields. Assemblymember, the floor is yours.
Good afternoon, everyone, and thank you so much for having me today. Thank you, Brian Woods, for that very, very nice introduction. I also want to thank Steve Russell and Laura Nunn and everyone at the San Diego Housing Federation for organizing this annual conference. And thank you to each and every one of you out there who's participating and has participated for the last few days in these very important and very timely conversations. As mentioned, my name is Dr. Akilah Weber. I'm so very honored to be here with you guys today. You heard a little bit about me. I am a San Diego native, actually grew up in the Oak Park neighborhood, and I now live in the city of La Mesa. I am a mother to 2 amazing, very busy, very energetic young boys. I'm an OBGYN, and I specialize in pediatric and adolescent gynecology and still have a small portion of my practice open at Rady Children's. And yes, I'm also a member of the California State Assembly representing the amazing 79th District, which includes parts of San Diego, parts of Chula Vista, parts of National City, all of Lemon Grove, all of Bonita, and all of La Mesa. And I stated, I'm very pleased to be your keynote today to share my thoughts and perspectives about housing. And so from the outset, you know, people may ask, well, what does a doctor doing talking about housing? But today I'll be discussing about the intersection of housing and health as a public health issue. So I'm going to start with talking about something that I talk a lot about and we've heard a lot about lately because of the pandemic, which are the social determinants of health. And so the U.S. Department of Health and Human Services define the social determinants of health as the conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risk. These determinants include everything from access to healthy foods, where health services are located in proximity to families, crime, education, employment, risk of incarceration, food insecurity, housing instability, and so much more. I really love this slide right here because it really talks about what determines your health. And as you can see, only 20% of what determines your health occurs within a healthcare setting. The vast majority of your health happens outside of the healthcare setting, happens within society. And 50% can be traced back to your zip code. And 30% are determined by your health behaviors, which many, as I would also be linked oftentimes to your zip code in terms of your ability to go outside and have fresh air, to participate in exercising, your exposure to commercial tobacco use and alcohol use. All of those oftentimes are determined by your zip code as well. So by identifying the social determinants, we physicians are better able to assess the whole person in order to offer appropriate treatment plans. I like to use obesity as an example. We talk about that a lot here in the United States. We have an obesity epidemic within our adult population, but also within our pediatric and adolescent population. And we know that obesity can lead to significant health issues, put you at risk for certain things throughout your life, put you at risk for certain things for women who become pregnant. And so when you come and you see your doctor, and now it's not only primary care providers that talk about weight, but your specialist as well. And so oftentimes we'll refer you to a nutritionist and they'll talk to you about, you know, the kind of things that you should be eating, the amount of fruits and vegetables that you should be eating, portion sizes, if you're going to eat, quote, fast food, the kind of places where you should be going. And in the past, we used to do that without really taking into consideration, does this particular patient have access to fresh fruits and vegetables, or do they live in what we now call food deserts, where there are miles and miles before they can get to an actual grocery store, where in certain communities you don't have access to whole food markets or farmers markets that happen during the week or on the weekend. You don't have access to healthy fast food type places like Mendocino Farms, where you have lots of it in certain areas within San Diego County, but absent in other areas. And so we understand that these social determinants, these social dynamics oftentimes play a part in what our patients are having to deal with, and it shapes the recommendations that we give them and how we give it to them. So we examine these complex conditions to advocate for patients to achieve better health outcomes. The whole person approach gathers as much information as possible to truly address the root of the issue in an effort to solve the problem and create healthy individuals and families. And it's no surprise that many of these factors that you see here impact the health of a person. So once a barrier or barriers, because oftentimes it's not just one, are identified that negatively impact affecting someone's overall health, medical intervention, and changes in policy are necessary to alter the course of their health trajectory. And I am so grateful that I have been able to create a new select committee within the Assembly, specifically focusing on the social determinants of health, so that we can engage in these discussions and we can have these workshops up and down the state to explore these issues and gather data to better inform public policy and future legislation. So I'm now going to focus on one of these social determinants, which is housing. And as I'm speaking to an audience of affordable housing experts, you all know too well the shortage of affordable housing in the state of California. Having a place to call home is fundamental to the quality of life. And I think that's something that we can all agree on. Having an address is critical to many services that make us productive members of society, such as schooling or having proper identification documents, to voting and much more. I always kind of chuckle on the inside every year when I enroll my boys into our local Little League. I have to show them my address and proof of my address to be able to enroll them for that year. Housing provides stability and the ability to feel a sense of belonging within a community. And so this is very, very important to the overall well-being of individuals and families. You know, the theme for this conference is remembering, reimagining, and reengaging. I like to call it the 3 R's. And it's a very timely and very important theme, which I will touch on in each part of this presentation. So the first part, remembering, points to the importance of recognizing one's past and reaffirming one's purpose. Many of us shy away from the misdeeds of the past, and we do that a lot, unfortunately, in this country, don't like to talk about some of the things that have occurred in our past as a nation. But it is said that if you don't know your past, then you are doomed to repeat it. The history of housing in this country is steeped in racist policies and actions, which have carried over into the housing and health inequities that we still see today. Richard Rothstein's popular book, The Color of Law, A Forgotten History of How Our Government Segregated America, brought to the surface the policies and practices that greatly contributed to our housing inequalities and inequities. And this history is not forgotten. Federally sanctioned redlining policies and predatory lending targeted African-American households from achieving quality and sustainable home ownership. The remnants of these actions are evident today with Black home ownership gap. So 44% of Black Americans own their own home, compared to almost 75% of white Americans. Consequently, Black households and other people of color are pushed into hazardous areas near industrial zones. Freeways were built through their communities, exposing them to the environmental toxins of cars. And exposure to other carcinogens have led to increased risk of cancer, childhood asthma, COPD, and other respiratory and medical issues that we still see disproportionately higher in these communities. Remembering our past helps solidify our purpose and your purpose as an organization, which is to right the wrongs of the past. So when you look specifically at the San Diego Housing Federation, your purpose is to advocate for those severely impacted by the absence of affordable homes. Protect those whose voices are often not heard. Expand expertise and focus on bringing best practices to the San Diego region. Using your organization as a networking platform and educating all stakeholders, whether they be your members, policymakers, or community members. And finally, building coalitions to improve a future for all within our regions. And why would you do that from a health standpoint? Well, we know that housing stability significantly impacts positive health and educational outcomes, as well as employment retention, because when a person or family does not have to move from place to place or worry about making rent each month, that adds significant stability. And a disruption to the stability can definitely lead to adverse outcomes, including health outcomes. Here in San Diego, where we are the second largest city in California, more than half of residents are rent burdened and paying more than 50% of their income on rent. Further, home prices in San Diego continue to skyrocket, with the median home price being approximately $850,000. That is so hard for me to say. What wasn't stated in my bio is that even though I'm a San Diego native, I left after high school and I lived in other states, did my education and my training in other states. And I was actually working in Dallas, Texas before moving back home. And coming back home to California from living in Texas, where the cost of housing is so much less, it is so hard for me and like a punch in my gut to say that the median home price in my city where I was born and raised, is so extremely high and unattainable for most people. Low and middle working class families are being priced out of the opportunity of home ownership, while the most vulnerable of us are being pushed out into homelessness. The California Housing and Community Development Department is estimating that our state needs to build nearly 2 million new housing units by 2025, or 180,000 units annually. But development has not been meeting that pace. To meet that demand, we need bold federal and state policies and the local government with the courage to do what's right. The severe lack of affordable housing did not happen overnight, and each stakeholder must assess what we are doing to improve that issue. Governor Gavin Newsom and my colleagues in the legislature have committed unprecedented funding to build more housing and bolster homelessness resources in all of our local communities. But there still continues to be debate about where housing should be built and who should actually make those decisions. So I stated, before my election to the Assembly, I served in local government as city council member and vice mayor of the city of La Mesa. And many affordable housing projects came before the city council that I definitely supported, but there were always community members, always community groups who were very vocal in their opposition. And so then it becomes a question, what do we say to members of the community who oppose housing projects? And for me, this is a great time to reimagine the messaging and how communities are engaged. We can go to the next slide. And, and reimagine it for those who support and also for those who oppose affordable housing. I think it's important that we remind everyone that housing is public health. If we care about the health of our communities, we must also care about housing availability for everyone. It is not productive to discuss or complain about the people and their belongings in the street while also opposing the very solutions to fix those issues. The other thing is, who lives in affordable housing is not a monolith, and we must destigmatize this and properly educate people on who needs affordable housing. Our first responders, our teachers, our trash collectors, the people who deliver our mail, the janitors who clean our office spaces, the food service people where we dine. They all deserve and need a safe and affordable place to live. You know, it's interesting. I was having a discussion yesterday with some of the residents at UCSD. Now, residents, they're physicians, they finished medical school, but they're doing training in whatever area of medicine they choose to practice, whether it's internal medicine or plastic surgery or anesthesiology or OBGYN, you've got to go and do specialized training in that area, and that's called a residency. So I was speaking with some of the residents yesterday, and one of the issues that they brought up that they have here in San Diego and actually throughout California is the cost of housing. And as we look within the medical profession and we look at healthcare and we talk about shortage of physicians and we talk about access to healthcare, we need to also include in that discussion housing, the ability to recruit, to train, and then retain physicians in primary care and subspecialty to provide the care to all of our residents, especially those in underserved areas that need more medical attention. So when we're talking about who needs affordable housing, it's really everybody that needs affordable housing. And we need to change the messaging around that to make sure that everyone is aware that the person that they see on the streets, as well as the people that are taking care of them when they come to the hospital, need to have access to affordable housing. And as we well know, a proven solution to chronic homelessness is permanent supportive housing. We must meet people at their point of need to provide low barrier access to affordable housing and couple that with wraparound services to bolster their self-sustainability. This includes making sure that they have access and are utilizing mental health services, job training, job placement, social support services, and overall health care. It is pertinent that policymakers and local stakeholders embrace the housing first model as a solution to homelessness. We cannot expect people to overcome their chronic health issues while living on streets or in their cars. And we cannot wait until they overcome a substance use issue before providing them a place to call home. As a medical doctor, I must also emphasize the health and safety concerns of our homeless neighbors and how the healthcare industry and policymakers must work towards effective solutions for care. The National Health Care for the Homeless Council reported chronic health conditions such as high blood pressure, diabetes, asthma became worse because there is no safe to places store and properly store medications if you live on the street. Common sense. We should all recognize that. Additionally, people who are homeless have higher rates of illness and die on an average of 12 years sooner than the general United States population. This drastic disparity in morbidity and mortality rates is alarming. The medical community is about saving lives, especially when more can be done for prevention. A consortium between the healthcare and housing industries to shrink this lifespan gap should be a public health priority. And let's not forget that people experiencing homelessness also have higher vulnerability to deadly and infectious public health outbreaks. And we have seen these over and over and over again here in San Diego. I'm sure that most of us remember the hepatitis A outbreak that we had a few years ago. And then more recently, we've had the COVID-19 outbreaks in our homeless shelters. And now we've got the Shigella outbreak among our homeless population. And not only do these diseases spread among the homeless population, but also then into the general public as well. So not having housing exacerbates these issues because you're not able to isolate, you're not able to rest when you need to, and you're exposed to the elements, and all of these issues just become compounded. Behavioral health issues are also triggered by these types of stressful situations for an individual. The healthcare system's role in connecting patients to housing resources is a key intervention strategy to capture people who are experiencing homelessness or are at risk of it. This not only helps prevent returning to unhealthy environments, but also reduces the frequency of trips to the emergency room, resulting in cost savings for the hospital and the entire healthcare system. As a physician, I love to emphasize prevention, prevention, prevention. I believe that preventative medicine, early screening, promoting healthy lifestyles are integral to preventing deadly health outcomes. We talk about it all the time, preventing breast cancer, get your mammograms, preventing cervical cancer, get your pap smears, preventing colon cancer, get your colonoscopy. So in the same manner, prevention is critical in addressing homelessness. Determinants of homelessness, such as areas where rent is high, where there is a shortage of affordable housing, and where unemployment rates are high. I know most of this sounds like a lot of California, but there are some areas that are worse than others. So focusing in on these may give us a starting point to implement prevention methods. The COVID-19 pandemic underscored the reality of the number of people at risk for homelessness. And many people are just one paycheck away from being homeless. Both short-term and long-term solutions are needed, such as rapid rehousing, down payment and security deposit assistance, eviction prevention services such as tenant relief, rent relief, and legal counseling, job connector services, education and training programs, destigmatizing and investing in mental health services, and addressing systemic inequities in our housing market and policies. And so as I close, I want to talk about the last portion of the theme for the conference, which is re-engaging. As one of the social determinants of health, housing stability and affordability and quality impact an individual or family's overall health outcome. Many of you have been laboring on these issues for decades. And I want to acknowledge you for all of your tireless work. I know that sometimes you feel like for every step you take forward, there's 2 steps backwards. But I urge you to continue to press on because there are people, there are families, there are communities, and an entire state that needs your continued commitment. As a new member of the legislature, I look forward to engaging with the affordable housing community at the state level. And thank you again to the San Diego Housing Federation for the opportunity to virtually meet you all. But as we think about the re-engaging part of today's theme, I challenge each of you to think about housing in a new way and to advocate for housing in a new way. Housing is public health, and we must approach policy and budget solutions with this intersection at the forefront to promote health in all policy discussions. So thank you very much for your time today, and I look forward to our further discussions.
Well, thank you, Dr. Akilah Weber. I wish we were in a room where you could hear the applause. I will tell you, I've been taken to school by your mother many a time, but I didn't expect that today. So thank you. That was really marvelous. I will, before we go into questions, I'm going to tell folks that we are going to take your questions. So please put them in the Q&A. We've got plenty of time here. And I've got a few questions myself. I also want to call out Ann McCall, who's with Liquid Graphics, who is doing kind of interpretation of some of the discussion and is going to continue through our questioning here. And all of this material, the session and the Liquid Graphics will be available to attendees of the conference. So some questions, if I may, and thank you again. I've got one more comment, which is we spend so much of our time advocating to electeds to bring them to a level of knowledge, experience, and heart that you are just bringing to us. And so I thank you for that, because that means that we are partners in this.
Yes, we are definitely partners.
So I guess first thing I would want to ask is that, like many parts of the economy, we have challenges in hiring trained staff throughout our sector, and more training and certificate programs that could attract new employees and help existing employees to grow in the sector would be really valuable. Can you talk about any thoughts you've given to how we could grow and strengthen the community college district system here in the state of California?
Yes, thank you so much for that question. And I think that from the legislature standpoint, we recognize and we are definitely placing a higher value on our community colleges. Because they are oftentimes the stepping stone into either jobs or into the four-year university for students who may not want to just go into a four-year university or cannot afford it. I had many patients over the last few years. I kind of saw more of an uptick as time was going on. There's a number of students that were graduating from high school and choosing to go on to community colleges instead of directly into four-year universities. And with that, yes, we must start to reevaluate some of the things that we're offering at our community college, including furthering our training programs. I'm very grateful that I'm on the higher education committee and that those are in the assembly, and that those are definitely discussions that we will be having to make sure that we are offering a wide range of opportunities for our students that are graduating out of those community colleges.
Wonderful. Well, so let me ask next, childcare. Because childcare remains a major obstacle for many parents, and really mostly mothers, to fully participate in the workforce. Can you share some of your thoughts on that?
Oh, yes. So like I said, I have two boys, and childcare has definitely been an issue. And one of the small reasons why I moved back to California, because I was like, I need to be around some family so they can help take care of these kids. But it is definitely an issue and something that we have been discussing, because we do not want childcare, the ability to access it or the ability to afford it, to be a barrier for women or men that want to or need to enter the workforce. And so we have started looking at investing more into different childcare facilities, also investing more into other early education interventions such as universal TK. Hopefully most people have heard about that. And another thing for me as far as childcare is, I loved it as a parent because it gave my children the opportunity to, one, gain social skills because they were around other young kids, and two, get that, what I like to call that academic stimulation that oftentimes they wouldn't necessarily get from me all the time at home. And so we understand that providing more funding for childcare, opening up more childcare slots, but also another key to that is starting to think outside the box as to what working means and what kind of childcare options we need to have. Not every parent works an 8 to 5 or a 9 to 5. Some people have to work at night. And so making sure that we are able to create a system that allows for people that have to work on off hours or on weekends to also be able to access those childcare facilities and those childcare options is also a very important part of the discussion as well.
Great. Well, and the whole age spectrum, because I mean, we have a lot of seniors who are challenged to stay housed, who have to be in the workforce, or if they're cast out. I mean, have you worked on I mean, some of the issues around seniors, I realize it's kind of a curveball maybe, but have you given some thought to how we can assist our seniors to not be so stressed by the economics?
Yes, it's definitely something that that I have discussed and thought about. You know, in my adult population, I did have adult and senior patients, and one of the things that we know is that we have an aging population, and it's something that we really do need to focus more on and provide more services to. And you know, stress has a very critical role on your overall well-being. And a lot of times we don't realize it because you don't actually see it. So if you get burned, you can see it on your skin, but you can't always see the impacts of stress on your body. But then you go to your doctor maybe for your annual and you wonder why is your blood pressure sky high? Or you wonder why you're having such a hard time losing weight, even though you have been trying to exercise and do these things, or why you're not able to sleep at night. So stress has a extremely important role on one's overall health being. And as you start to get older and you have to deal with other health issues, we definitely want to make sure that our aging population is as less stressed as possible. And so looking at some things that we can do from the state level, but also working with our local communities and our healthcare facilities, because oftentimes our aging population lives in various healthcare facilities, to make sure that they're less stressed, that they're able to get out, they're getting good nutrition, great exercise, to keep their bodies and minds active, alive, and contributing also to society in whatever way that they deem necessary, whether it's through artwork, whether it's through working with our, you know, the younger kids, or just interacting with each other is very important.
Super. Well, so I've still got a couple of my own questions, but I'm going to pull from the public here. So one here, what resources are available for undocumented students / DACA students in higher education? Coming from first-generation college graduates, it was very difficult for me to navigate as a DACA student in college. Susanna asking.
Oh, thank you so much for that question, Susanna. You know, we are definitely working on making sure that those options are available and easier to find. I was just in Washington, DC, speaking with our congressional representatives and our senators. And this particular issue was one that came up, the fact that we need to make sure that that information is out there so that our DACA and our undocumented students have more access to information that is easily available for them.
Okay, thank you. And then Carol asks, or says and asks, I really appreciate your framing of this issue as a public health issue. So how can we as advocates engage the healthcare sector in our efforts to create more opportunities for affordable housing?
Oh, that's a really great question. And, you know, I was very excited to see that someone from the board of San Ysidro Health was introducing me, because really it's oftentimes starting with the community clinics and the community facilities, because they see the patients, they understand the issue. And, you know, to be quite honest with you, oftentimes us in the medical profession, we know what the problem is. We just don't know who to engage. And so when you start to step out and start to have these conversations with your local clinics, whether it be the San Ysidro Health Clinic or some of the other family clinics in the area, I am certain that they would be more than willing to help and engage in these conversations, because we see the issues of patients that don't have housing, that continuously come into the emergency room. You know, people go into the emergency room. I'm here in La Mesa at Grossmont, and they complain about the wait time, right? But it's the same people that are coming over and over again. Oftentimes those who are experiencing housing issues, oftentimes those who are experiencing issues with mental health issues. And so working together, we can create systems that streamline a process and help everyone. So we're not duplicating, and, you know, working together really helps out a lot. But I am certain that if you approach them, they would be so excited. And I'm happy where I am because I'm able to bring in both of that, the legislative policy side, but also the healthcare side, to the discussion at the state level, and then, speaking with our local electeds so that we can really start to implement some significant policy changes in those areas.
Super. Well, and one discussion that's often had is around the hospitals, who we think of the doctors there who are well paid, but there's so much of the staff in our healthcare sector are at that 80% and below. And so, we're looking at broadly at, can employers play more of a role? Just all employers play more of a role in housing some of their workers.
That is so true, because I do think that's a myth that physicians make a lot of money, but in the healthcare system, it takes a lot of people to make a hospital work, right? It takes a lot of people, whether it's the person who's greeting you at the door, or if you're going in for surgery, the person who's putting you in the wheelchair and taking you to the into the operating area, the person that checks you in, the person that answers the phone when you make an appointment, the person who is in the cafeteria serving you your food, the person who cleans up the room. So there are so many people outside of those who are medical, right? So I'm not even talking about your physicians or your nurses or your CNAs or your LVNs or any of those people. But to make a hospital run, there are so many different people, and they are in the same boats as everyone else. And like I said, even our residents are as well. San Diego is a very challenging place to live. And, housing is a huge proponent of that. And when I talk about retaining and recruiting for our residents, but also for physicians, because if you look to say, okay, I'm done with my residency, am I going to go and live in San Diego, where the median household is $850,000 to purchase a home? Or am I going to go and live in Texas, where I can purchase a home for $250,000, right? So, and then we get into what I was saying before, physician shortages in subspecialties. I had another meeting yesterday with our Children's Hospital Coalition up and down the state, talking about the shortage that we have in specialty care for our pediatric population. And what does that entail? What does that roll out into? Longer wait times. So when you're calling to make an appointment for your child to see a neurologist because they have seizures, you've got to wait, instead of waiting a week, you've got to wait 2 months, 3 months for that first appointment because of a shortage of physicians. So there's so much that goes into it. And believe me, Stephen, these discussions are already being happened within the medical profession, happened within the hospitals, because they see the shortage, they see how it's impacting the patients that they're serving, and also the people that work there that are burnt out. And so having the discussions together help create better solutions.
Well, and that's something we're really looking to you to help us with, I think, is to help with those relationships, because there's nothing like having someone like yourself hold each of our hands and pull it together.
And bring it together.
Yes, exactly.
I definitely look forward to.
Thank you. Well, so a couple other, different topics. And first of all, I do hope you're looking at all the love you're getting in the chat section here. People are, if you don't have the chat open, there's a lot of applause, a lot of kudos, and so I just want to make sure you see that. I don't want you to leave without hearing all of that. So when we talk about just maybe staying on health a little bit, Eric from the City Heights CDC asks that resources funding is the single greatest barrier to producing more affordable housing, and housing stability is arguably the most critical social determinant of health. So why aren't more health systems investing in affordable housing?
Thank you so much for that question, Eric. And like I was just saying, the discussions are starting to happen. I'm having them with the different healthcare entities, because they recognize how it's impacting their individual healthcare systems. The lack of housing, the lack of ability to recruit and retain, the lack of being able to get jobs on all levels within the healthcare system. They're feeling it. And they understand it. And I would be surprised if, very shortly they don't start engaging in how we can start to help improving our housing options here in the state of California.
Yeah, wonderful. Well, because two sides of that coin. A number of our members, Wakeland in particular, National Core work in San Ysidro Health, Family Health Centers is building housing. There's a lot of partnerships. but we haven't taken it to the hospitals, to the larger sector. And so I do know UCSD and their growth plans has a lot of housing when they replace UCSD Hospital here up in Hillcrest. So there's housing there. So I feel like the conversation is opening up, but really we want to take that open and we want to charge right in and make some change. Can I ask you on a different topic? Back when you were a La Mesa council member, you were really a strong advocate for local transit. And right now there's a strong push to create youth opportunity passes to provide free transit to youth in this region. And is this an important initiative to you? And do you think there's things you can do at the state to strengthen the initiatives like that and our transit systems in general?
Yes, there is so much that needs to be done with our transit system. And when I was on City of La Mesa City Council, I served on the MTS as their board representative. And we talked about youth opportunity passes quite often. And it is something that I support, giving our youth the opportunity to be able to ride on our transit system for free. I think that it's important for them to be able to get to wherever they need to go, but it's also a way of introducing a different mode of transportation. To engage earlier in public transportation than later is extremely important to continuing it once they become adults. But on the other side, we also need to improve our transit infrastructure overall here within the San Diego region so that more people choose to do that instead of getting into their cars or getting an Uber or a Lyft or whatever other kind of car service may pop up tomorrow or next week. That is extremely important to increase ridership in the adult population so that we can increase the amount of funds coming in to offset the youth opportunity passes so that we can not only do them, but do them until someone is 21. And there's also a discussion until they're 25, because many people are still in community colleges and then go over to four-year universities and still need that opportunity as well. But we've got to invest in that, but we've got to invest overall just in our public health transit system or public transit system so that people choose to use it, get off the roads, cut down on traffic. And we had engaged in something called San Diego Vision 2020, where we were planning on going to the ballot to see if San Diego would, the residents in San Diego would be agreeable to some kind of tax measure to help us improve our transportation here in San Diego region, and youth opportunity passes was a part of that discussion. Unfortunately, after all of the community engagement that we've done and getting ready to really kind of hone down on the wording for the ballot, then COVID hit. And it's never a good time to try to put a new tax when you've got a pandemic going on and many people out of work. So hopefully at some point that will be re-engaged, along with whatever kind of funding can come down from the state. But again, yes, I support youth opportunity passes, and we also need to improve our overall public transportation system here in San Diego so that more people choose to use it because it's easier and more convenient for them than to just get in their car and drive there.
Well, so during the course of the week, I heard a commentary on the youth opportunity passes suggesting that a lot of our unhoused neighbors could also really benefit because there's a criminalization. They can get a ticket for riding a trolley if they're trying to get to a medical appointment, to do any of the basic needs that we accept as necessary. And so I just offer up a comment from earlier this week that as we look at youth, let's also look at the other folks who are similarly really in need of that kind of transportation.
Yes, I agree. And one of the things I was very happy to serve on the public safety committee for MTS, and we got rid of those things, such as giving someone a ticket if they're homeless and they happen to be using public transportation, and started engaging in a different kind of process to see what we could do to kind of not encourage that behavior, but if we happen to see it, not criminalize it. And so I know when I left, we were going through the pilot program, and hopefully it's something that MTS will continue once the pilot is over, to make sure that, we're not giving out tickets, we're not putting people in jail, we're not having people with these, compounding fines that can't afford it, anyway, so.
Well, in some cases, they're there because it's a shelter, but in many cases, they're actually trying to do their daily business like anyone else would have, getting to the benefits office or getting to the doctor, getting to where their things are.
Exactly.
So it can be heartbreaking out there, and that's why it's so inspiring when someone like you is in a position of power to make things better. Can I ask a different question now? When we talk about kids and after-school programs, those are an important part of the resident services that many of our folks provide at our affordable housing communities. Can you share some thoughts on how we can create more activities for youth, and then how can we also make it safer for them to walk and bike to many of those same existing activities?
Mm-hmm. So I am a huge supporter of after-school programs, being that I have two, and pre-pandemic, they were very active every day in something. Now, post-pandemic, we're slowly getting back to certain activities, but it not only keeps kids off the street and keeps them out of trouble, but it helps with their overall well-being. It helps with their mental well-being if they're doing something like a chess club that is, academic. If they're doing something like science or robotics or coding, that is definitely needed. If they're doing something like soccer, baseball, jiu-jitsu, karate, that is helping not only with learning teamwork and sportsmanship, but it's also keeping you active and athletic. And I talked earlier about the epidemic of childhood obesity. So there are so many positive aspects to after school programs. In addition to, when they're doing that, they're not doing anything on the screen. They're not watching TV. They're not on their video games. And those are all things that, from a physician standpoint, we want kids to not do as much as they are doing today. And so, working very closely with certain organizations like your local YMCAs, your local Boys and Girls Clubs. I know here in La Mesa, even our own city has different activities for our youth within the community, within our community center. Those things are important, and they're important to make sure that local governments continue to support and fund them, that local governments in conjunction with the actual entity continue to look for different grants and programs that may come down from the state to help fund for its continuance and more after school programs. But I do know that, certain programs through the YMCA are available pretty much into the night. And if someone needs financial assistance or, can't pay for it, they do have funds, and we continue to look at them and support them to make sure that they do have funds to make sure that any child who needs it and wants it can do it.
Wonderful. Well, so in a moment, I'll ask you if you have any last words, but I do want to ask folks if they have any last questions, to put them in the Q&A if you can. And I do want to read just underscore something that Cooney wrote when we're talking about folks who are unhoused riding transit, that they may well be riding to work, right? Mm-hmm. Because we know that a lot of folks who are homeless are keeping one or more jobs, and that still is not enough to keep a roof over their heads. So thank you, Cooney, for putting that in there. Any other last questions? I'm just looking through the chat to make sure I don't leave anybody out. Do you have any final words that you'd like to close with?
Well, I really just want to thank you once again for inviting me. I've had so much fun in this discussion, but it is such a very important topic. And I think too often in society, what we have done is we have looked at things from our own lens. So if you are a housing expert, you look at housing from your own lens without realizing that housing is a larger part of the conversation. Within healthcare, we have looked at healthcare from our own lens without realizing that it's a larger part of the conversation. And I think with the pandemic, it has really kind of shown a light to say that all of these things work together. They can work together to be a benefit, or they can work together to be a detriment. So when we looked throughout the pandemic for who was being impacted more with COVID, and we saw it within our Black and Brown and lower socioeconomic communities, and then we peel back another layer and we said, well, yes, these are oftentimes communities that don't have access to healthcare. Not that they don't have insurance, but that they don't have access to healthcare because clinics may not be there, hospitals may not be there, subspecialists may not be there or easily accessible. And then we peel back another layer and we say, well, the risks for COVID are diabetes, hypertension, obesity. Oh, you see it greater in these communities because they don't have access to fresh fruits and vegetables. They are in food deserts. And, you know, you talk about going outside and getting exercise. Well, they don't live in areas that have a lot of open parks and clean spaces and places for after school activities, right? And then you look and you say, oh, these are also the communities that have issues with their education system, huge gaps in academic achievements. You talk about jobs and environmental justice and issues of systemic racism and the stress that that plays on your system. And so the pandemic has really shown us that all of these things, including housing stability, impacts the healthcare and the health of individuals and entire communities. And so, you know, I'm excited to be participating in this conversation. I think that we all now realize that if we really want to make significant change, that we've all got to work together. And I look forward to continuing in that effort.
Wonderful. Thank you. Thank you, Dr. Weber. I want to thank you for bringing both truth and hope to us, because I think neither is good without the other. It's just marvelous that you're here and be able to share, and that so many members of our community can get to know you.
Thank you.
Thank you also for being on theme, the remembering, reimagining, reengaging. I'm moved by every word you've said, and I will tell folks to please send your notes. We will share any other comments you have for Dr. Akilah Weber. And with that, I will thank Assemblymember Dr. Akilah Weber for being here with us today, for leading us through an important keynote session.
Thank you. Thank you all so much for having me.
Okay, and I think we're going into speed networking and exhibitor space, and people get to go have lunch. So thank you everyone for being with us, and we look forward to seeing you at our last, I think we have a couple more sessions today. Thank you all. Thank you, end the call.